I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. Should you have to pay for your health care? It's a really hot topic, contentious, brings up a lot. But I wanted to dive into it today because whether or not we believe that people should have to pay for parts of their health care, I think that the way we approach this problem as an individual is either helping or hindering our progress in our own health. So again, whether at a public health level, this is something that we believe needs to happen for our communities and for society in general, I want us to have a conversation about how your mindset about paying for healthcare influences you as an individual. I know when I entered university, I had a health policy class, and it was I can't remember if it was in first year or second year. It was early on in my undergraduate career when, my sense of responsibility to others, my sense of my own voice and thoughts having an impact on others was certainly much less than it is now. We had to basically research various models of healthcare and decide whether or not we thought that healthcare should be, fully funded, partially funded, or completely out of pocket. This was our project. And I remember my professor saying something quite profound, saying that, even if we made healthcare $1 to use, right? So if you went to the hospital and you had an emergency and it was $1, that principle or that cost would present a barrier to someone, or it would change the consumption of healthcare for someone, and probably not the person we mean to influence the way that they use healthcare, right? If we think about the person who would really struggle from a $1 entry fee into the emergency department, are we okay with that as a society that person doesn't get to go? And so on some level, the question isn't really about how much does it cost, but does it cost at all? And if there is a cost, I think we're harming communities and we're harming people because of the way that they either do or don't access healthcare, or can or cannot access healthcare. And that's not really the conversation I want to have today. That's not what I mean. But I remember that point. I remember my professor saying, Jordan, even if we made it $1, someone is harmed by that decision. Fast forward now many years later, I didn't go to university with the dinosaurs, but it definitely was, it was definitely pre-Instagram, we'll call it that. And working in privatized healthcare for the last 15 years, I have a very different, very complicated relationship with paying for healthcare. The services that I provide are not covered under the publicly funded healthcare system. And certainly, as a consequence, that means that there are people that choose not to, cannot use the services. But the conversation I want to have today is mostly about mindset. So if healthcare and there's aspects of healthcare are not accessible to you because of cost, I understand that deeply. And I do think that we as a group or as a society need to have methods for people to be able to access all the parts of healthcare that let them be their best self. It's more what I want to chat about today is not the policy around it. It's around the mindset of it. And after working in healthcare, privatized healthcare, for 15 years. And my husband also used to work in privatized healthcare as well. If you've ever followed along, my husband used to be a dentist and retired from clinical practice to pursue something else. But we've talked about this a lot because we both faced very similar challenges in working in privatized healthcare where, we would try and help encourage people to see the value in their health, they would be frustrated that they needed to pay for such procedure or lab work or what have you, and then out of the other side of their mouth talk about their vacation to Barbados. We always really kind of struggled with that, because the fact that so much healthcare is, I'm going to say in air quotes, and these are like the most air quotes I've ever done, healthcare isn't free. But let's say you don't see the cost of the majority of your healthcare as a Canadian. And if you're an American, you may not see some of your costs based on how you consume healthcare, insurance, etc. It creates this, unusual kind of thought pattern, and it really, it makes you have to value your health in order to prioritize certain aspects of your healthcare. And we, as the professional who had to negotiate with patients about whether or not their lab work or their root canal or what have you was valuable enough to get on the table of the things they spent money on, was exhausting. And exhausting for him, right? Like dentistry has very high burnout and quit rates for professionals for various reasons. But this was one of them. Like, this was a very challenging piece. And I would say I suffer from the same challenges where I'm trying to negotiate the worth of someone's health to them and encourage them to think about their health in a way that, again, maybe means that it needs to be thought of in the same vein as your vacation to Barbados. So that's the kind of conversation I want to have today. I want to talk about that, like, I shouldn't have to pay for that mentality and what that might be doing for you. Again, it's probably not to your knowledge, but I'm going to say it accidentally has an impact on you that I don't think you intend. That when we put our foot down and we say, nope, I'm drawing this line, I will not pay for that. What we're actually saying, or what we might be saying unintendedly, and then what the consequence of choosing not to place value on that particular thing, whatever it is, whether it's physio or psychotherapy or getting some lab work done, what the unintended consequences are of choosing not to place value on those aspects of your health. That's the kind of conversation that I want to have today. It's a much more individualized conversation around the should we or should we not pay for healthcare. I do think that we probably, and this is not for today, for a different day, talking about the cost of delivery of healthcare. I think sometimes when we go see the physiotherapist and it's, $125 for your session, we go, wow, must be nice. He's making $125. Let's be real. The margins on healthcare as an individual are really poor because the cost of delivery of care is mostly unseen by the consumer. And to get you in a room one-on-one with a professional that, they had to mortgage their brain for $150,000 in order to gain the credibility that you're looking for. And that's what I call it when we take out a student loan, is that we're mortgaging our brain. The cost of them maintaining their license, their continuing education, their insurance, the room, the staff, the lights, right? Like, when we look at all of those pieces and the fact that we really all can only see maybe 9, 10, 15 people per day, what we're asking for actually in that model is for healthcare to be relatively expensive. And so this is not that conversation either, although I obviously have a lot to say about that. It's more about this sort of transferring ownership and transferring responsibility when we feel like we shouldn't have to pay for something. Now, we can talk about the pros and cons of money, and that's really not my area of expertise. But money really is just this value, right? Like, when we're buying something, when we're paying for something, we're assigning value to those things, right? You may or may not choose to get designer clothes. You may or may not choose to get organic produce. You may or may not choose to get a grande over a tall. And again, making that decision based on a cost perspective. I'm always making that decision based on a caffeine perspective. But it's really just about value. And so when we start to have that money health conversation, your health actually is in your budget, or maybe should be in your budget of the way that you value things and put money towards things. It's remarkable that our cell phone bills probably exceed our healthcare bills on a monthly basis, right? So again, when we think about where we're placing value, if your car and cell phone and big house and trips and all of those things are, outweigh the cost or spend or value that we place on us being well enough to do all those things. It's really interesting, right? And we say, well, I have to have a cell phone. Well, you also have to be alive in order for the cell phone to matter. And I think, as a relatively well group of people, maybe listening to the podcast, maybe you can rely on your health, or you can, not worry about your health being there for you one day to the next. But this concept of at some moment, we're maybe going to have to shift the balance where we place some value on our health. And what does that look and feel like when, for the majority of time or the majority of your healthy, well life, you haven't had to do that, right? Where something's been free-ish in the past, and now there is a cost to it, right? We cross this threshold where now you need some additional care. Now you've fallen and you need some rehab on your knee. Now you're struggling with your stress and we need to pay for mental health support. That shift is really tough, right? It would be and what it feels like, I think, to people is well, now they're charging me for the air, right? I used to breathe and it was fine, and now they're trying to charge me for air. That's not really what it is. It's that as your life changes, as your health changes, as we age, there is a shift in balance for how much emphasis we need to put on our health. And as a consequence of that, the value shift that maybe needs to happen there, and where that spend, I'm going to say spend meaning emotionally, time-wise, and money-wise, needs to go towards in order for you to be your best self, right? You certainly don't have to pay out of pocket or do things that cost money for your health. But you can't have this desire and want to be on a trajectory of your very best self, but also want the publicly funded healthcare system to mop up all of that responsibility. And I'm using that word responsibility. I actually do think when we don't feel like we should have to pay for something, what we're maybe saying sometimes is that I shouldn't have to be responsible for that. And so the unintended consequence of that belief, of that feeling that I shouldn't have to be, I'm going to use the word responsible for this, is that it isn't, that's like an infection in your decision towards wanting better health. I want this, but I don't want to have to be responsible for it. Again, I am not talking about affordability, all right? I'm just talking about responsibility. I want something, but someone else, something else, some system needs to be responsible for me pursuing that. So I think that does a couple of things. I think I called it an infection. I think that's an infection in your decision to want better health. If you come up against this roadblock where at some point you want to transfer the responsibility of pursuing that health goal to someone else or to something else. And I know that I'm pushing buttons here on purpose. I want you to think about this in a really raw way, is where along your pursuit of health and your journey have you maybe subconsciously said, I don't want to be responsible for this, but I want the outcome. Now, I'll tell you, and you probably know this, right? There is about 1 billion free workout videos on YouTube. How come none of us can do it? How come we even need a gym or even need a trainer or how come? The YouTube videos are there. Yoga with Adrienne is there. Why do we still go somewhere else? And the reason is and patients will say this, I have to pay for that in order to show up, in order to feel accountable, in order to value it, I need to pay for it. Unfortunately, there is a free version of some apps and we will get the paid version of some apps. And the reason is that when you've done that value exchange of spending money on something, you will do it, right? Because you see that charge on your credit card, you like, yep, I'm going to go. I have a membership, I'm going to go, right? That's why when we're starting to think, that's why I think it's an infection in your decision for change. If you would like there to be no responsibility placed on you for pursuing it. Because we already know it doesn't work. We already know that when something is widely available and free, that our consumption of it becomes flippant, that our ability to even prioritize it in our own life becomes difficult. I will give patients the option of pursuing an OHIP-funded lab requisition if the lab tests should be done under OHIP. And not every test should be funded by publicly funded healthcare, right? Publicly funded healthcare is about keeping all of us alive today, right? That's really what it's about. It's about emergency medicine. It's about population health. If you as an individual are having some thinning of your hair and would like to have your iron tested, I'm not sure that everyone should be paying for that. I don't know. Like, I'm not making this a political discussion. I'm just saying, if you have the desire to improve your personal health, that might be something that you need to take responsibility for. But if something is, technically falls within the realm of public health, I will give patients the option of having a requisition completed by their family practitioner and it covered under the provincially funded healthcare system. The number of people who get a free requisition who never go for their lab work proves this point completely. When something is given to you for free, you can't put it in your agenda. You can't get it done, actually. You will choose to go to work instead of going to get your lab work done. You will forget. And then your appointment will come up where we're supposed to talk about the lab work and it's not ready and you're not ready and you actually haven't even thought about it. And shoot, I don't even know where my requisition is. When patients pay, and even like that small cost, like entry cost, right? So let's talk about the iron hair loss thing, like your requisition, like the iron test is like $10 and the requisition and blood draw is probably like $20 or $30 depending on where you live. That opt-in, that $50 opt-in to that process means that people go. They find time for it. They don't lose their requisition. They don't ask anybody to help them. They actually just do it. And so that point that I'm making there, that I shouldn't have to pay for this being an infection in your process, the person who never goes for their lab work doesn't get any better. They never find any answers. And so even if you're skirting some of the costs somewhere in your healthcare journey, I'm going to do this until my insurance runs out. I'm going to try and get this done through my doctor. I'm going to go and see the nutritionist through OHIP and have to wait 9 months. And by that point, I probably forgot why I made the appointment in the first place, right? This idea that, again, we don't want to take financial responsibility. What we're actually saying is that it's not important. What we're actually doing is taking it off our agenda, out of our frame of reference, off of our priority list. Because we know that it's human behavior, that if we give you something, if we hand you something, that you don't value it, right? And again, I'm not saying whether this is right or wrong. I'm not saying whether or not policy should exist, that every requisition is free ever. All I'm saying is I want you to reflect on where you draw the line. And is that really in your best interest where you're drawing it? That's the conversation I want to have today. Where are you transferring responsibility to someone else? And is that actually helping you, or is it getting in the way? Because it's funny, because the patient who wants to go get a free requisition or, doesn't want to come back after their insurance has run out or whatever it is, right? Whenever we create a cost barrier in our own minds about when we should stop doing treatment, those people are also probably spending hundreds of hours per month online seeking health solutions. and not really valuing their own time, right? Like you maybe could have just had an appointment and had with someone who knew a lot about the thing that you're trying to solve and have mopped up your issue quite quickly. But instead, again, we're willing to kind of like personally waste time in order to try and pursue that. That's what I want you to think about today, is like where are you drawing the line? And for sure, like I think you probably should draw the line somewhere before you spend $1 zillion on, Dave Asprey's biohacking life kind of plan. I'm not sure anybody needs that kind of stuff in their health, but there's probably a point where you're choosing to not move forward with something based on cost or based on that perception that you shouldn't have to throw some skin in the game. My argument is do we respect the things that when we have zero skin in the game? Do we respect it? Do you miss appointments if there's no cancellation fee? Do you show up late if there's no consequence? Do you go for your lab work if you haven't paid for the requisition? Do you do your at-home physio exercises if your insurance covered the appointment? If you don't have skin in the game, do you actually do the work? Or have we transferred responsibility because we've transferred the cost to someone else? And as a consequence of that, like, yes, it's free, but going to an appointment never got anybody anywhere. It's the at-home exercises. Getting a requisition doesn't solve your healthcare. Going for the lab work and then having a follow-up is what changes your health. So if we transfer responsibility from day one to someone else, I betcha that you don't respect following through. And now you're not better, right? Now you're not further ahead. Now you're frustrated because your health feels exactly the same as it did before. So what's your personal way out of this situation? I want us to sort of develop some thoughts or maybe even language around what this could look or feel like for you. And again, I'm not talking about, maybe I am a little bit talking about affordability. I think sometimes we'll say things like, I can't afford that, when we really should replace it with, I don't value that, right? Because if there was suddenly a beautiful sundress on sale at your favorite store and it was $55, who are we kidding? Like anything right now, nothing is $55, Jordan. Come on. What is this? Like 1980. You see a beautiful sundress, it's $100, right? How likely are you to scoop that up? And if someone said it's $100 to do your lab work, and this is going to really change what we do and probably help us get better faster and uncover this reason because you're really frustrated with where you are in your health, do you see those two things on the same spectrum? Where are you placing value? And where does health fall in that framework? So I'm going to leave us with a couple of questions. And this is what I want you to sort of ask yourself. And I think this is going to help tease this out for you a little bit. The first question is actually, what is the cost of not getting better? One of the things I love about working with entrepreneurs is that they're doing the daily calculation on the cost of not doing something all the time, right? If you were your business, if you are the sole person who must show up every single day and 100% of all the revenue flowing into your business relied solely on your ability to show up, and not only that, you have to show up at 110% of excitement and creativity every single day, suddenly your sore knee becomes a barrier to income. Suddenly your headaches start to get in the way of your performance. And so entrepreneurs are constantly doing that daily math on, I should go to bed so that I can. I need to go to the gym for my stress reduction so that I can, right? Because they constantly need to do that mental math on what it feels like and looks like if they show up less than their best self. And I think are more willing to spend time, energy, resources on themselves being their best self, because the consequences of not being their best self are very topical. They can tell, they can feel it. If you show up at the thing and you're not your best, you don't make the sale. And so I want you to ask that question, like, well, what is the cost of me not improving? What's the cost of staying the same? And that might mean enjoyment cost. If you're in pain, do you enjoy life? Do you say yes to the hike? Do you get to participate with your grandkids, right? What's the cost of staying where you're at? Then there's the financial cost. Are there future costs associated with staying the same? If I don't do this physio now, what will this look like for me later? If I don't do the blood work now, am I going to run into a bigger problem and now my lab work is 10 times what it was if I had just done it, 2 years ago? If I don't follow through on these appointments with my psychotherapist, what is the ongoing cost of medication or missed work days or what have you by not taking care of my mental health? What is that cost? And usually when I'm making decisions about my health, I will map that out, the cost of not getting better. And so whether it's I have a sports related goal, and so the cost is going to be in my performance, whether it's I can't work as much if my mental health is not that good, so I'm going to invest in my mental health so I can keep working the number of days a week that I do work. That formula or that math is something that I'm doing personally quite often. Because it can help you see, like, if you spend a little bit now, what does it save you later? If you can have that frame of reference in your mind. But I think we sometimes push our health under the rug. I'm not that bad right now, right? Things aren't that terrible right now. I want better, but they're not that terrible right now that I'm willing to feel the loss of putting some blood work on my credit card, right? I'm going to feel the pain of paying for my physio appointment more than the pain in my knee. And the pain in my knee is not that bad right now. And so I'm going to just live with that, right? But if you looked at, if someone said, if you made a $10 investment today, again, $10, Jordan, where are these examples coming from? If you made a $10 investment today, it could be worth $1,000 in 3 years. I betcha that there's some aspect of your health that you are avoiding taking responsibility for that has that same math associated with it, but you just haven't thought about it in that way. So the question I want you to ask, and if you're journaling around or after this podcast, that's one question I want you to write down. What is the cost of me staying the same? What's the cost of me doing nothing? And as doctors, we're actually supposed to talk about that with patients, the cost of inaction, which rarely that happens, right? If we go to the doctor and we have depression and they say, here's the Prozac, we rarely talk about the cost of doing nothing. And technically that is part of good informed consent. If you did nothing here, this is the path we might go down. If you don't take the medication I've prescribed for your chronic pain might get harder to treat in the future. We don't do that enough in healthcare, but technically that is something that we should be considering. And if you don't know, if you're like, if I do nothing about my rheumatoid arthritis today, what does it look like in 2 years? Ask someone who knows, ask someone you trust, ask your physician. What's the cost health-wise of doing nothing? And it might help contextualize for you what path you're on, because we sweep those kinds of thoughts under the rug. We don't often think about what my future risk and future health looks like. We just worry about today. We're always in kind of that damage control, and we're not in that future health planning kind of phase. I always like to think about healthcare appointments, especially with my women over 40, as like the same appointment you would have with your financial investor, right? We spend all this time getting ready for retirement, and yet health-wise, we just think about the day-to-day. Oh, I have a headache today, right? Anyway, so that's one question I want you to ask yourself. What is the cost of inaction? The other question I want you to ask is, like, can you get where you want to go without throwing some skin in the game and without having some personal responsibility for the journey? Now, there are some people that can skirt by with free physical exams and again, free, major air quotes, but publicly funded healthcare because they're otherwise quite well and their goals are to be kind of well and fine. If you have health optimization goals, if you have a condition that's affecting your life, if you have something, a barrier, a pain point that is affecting your ability to show up as yourself at 110%, can you get there without throwing some skin in the game towards that goal, right? I have some athletic goals. I don't think anyone should be responsible for me achieving those goals other than me. And if you have a goal of thicker hair, less headaches, better energy, right? Can you get there? I keep wanting to say do. Can you get there without throwing some skin in the game? And maybe that's money wise, but maybe that's time, maybe that's emotion, I don't know, right? But thinking about that same idea, like, what's the cost of doing nothing? Okay. Do you have a goal? Can you get there without some personal responsibility being involved? And the answer is probably no, unless your goal is to stay exactly the same as you are and you're super happy with, I'm going to say mediocre health. And that's totally great and fine. But if you have goals of greatness, you have to have some personal responsibility for how you get there. And my guess is that phrase that you say in your head, wherever it is, wherever that line in the sand is where you say, I shouldn't have to pay for that. My guess is that feeling the way you want to feel is on the other side of that statement. Wherever you've drawn that line, feeling well and accepting personal responsibility is just on the other side of where you've drawn the line of where you don't want to have to throw skin in the game. I want you to think about that. I want you to think about that the next time you're at an appointment where someone says, this is what it looks like to be on a path to get you better. Do you choose Barbados or do you choose the root canal? Do you choose the sundress or do you choose the lab work? Do you choose the Netflix or do you choose the physio exercises? Throw some skin in the game. My guess is that helps you get to where you want to go. And I've watched it working with thousands, I think we're at tens of thousands now, patients. The ones who grab the lab work requisition that they've paid out of pocket, go. The ones who take their care beyond their insurance because they know that that's what is actually needed. I mean, I don't know who decided that X amount of dollars per year is what you get. But they didn't go, how many visits does Julie need? Okay, let's give her that amount, right? It's an arbitrary number that may or may not get you to the health goal that you have. My guess is if you make the decision to invest in your health, that you actually get closer to the goal that you have. So pay attention. The next time that those words are forming in your mouth, I shouldn't have to pay for that. I mean, first of all, who should, I guess? But are you transferring responsibility somewhere into someone else? What's the cost of doing nothing? And can you get where you want without personal responsibility, without throwing some skin in the game? Because I don't know if we can. I don't know if under the current climate of healthcare, if you can get exactly where you want to go without responsibility. I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.